For a month, North Dakota's chief health strategist has been advising that the state begin more extensive coronavirus testing to detect when new variants arrive. That was back when 76 cases of the variant that was first identified in Britain were reported in the U.S. Now there are 932 cases. As Renee Cooper reports, the state's public health lab is getting on top of this more complex, more expensive form of testing.
A positive PCR swab test tells you have the coronavirus or not, but it alone can't tell you if you've contracted a variant.
We see this with other illnesses, but we want to pay particular attention to those that could potentially threaten during this pandemic.
Public Health Lab Director Dr. Christy Mason announced the state's strategy to track variants Wednesday at Governor Burgum's press conference.
We are actually able to screen most of the positive samples that come through the Public Health Lab for the variant.
There is nothing alarming yet.
North Dakota's chief health strategist Dr. Joshua Wynn says there are some signals when you look at a positive test that suggest a variant. So the lab is looking at those tests further.
And there's a number of different ways that we can do that.
In addition, the lab is conducting whole genome sequencing. That is, taking a positive test and analyzing the entire genetic code. It's a sequence of thousands of letters, including those specific to the variant.
We're working closely with our partner at the CDC, and we are actually submitting a random sample of 17 of our positives every 2 weeks to them.
Now, you can't do that on every sample. It would be hugely expensive and not something that is practical, but they do it randomly and periodically, and fortunately they haven't detected it yet.
But he says he wouldn't be surprised if one of the 3 major variants being tracked in the U.S. appears here as time goes on.
Doing a cost-benefit analysis, basically, are we doing enough of these genomic sequences?
I think so. In North Dakota, I feel really good about what we do. I'm not sure how uniform that is around the country or around the world.
Reporting for KX News in the capital city, Renee Cooper.
Dr. Wynn says moving forward, nationwide and even global public health systems need to test and record this data in a more coordinated way because the virus knows no borders.